My name is Nos Hilaria. Welcome to my channel. Okay, if you have not subscribed to my YouTube channel, do and subscribe so that you will get notification anytime I post amazing videos like this. Okay, now let's discuss about hepatitis infection. Yes, make sure you watch this video to the end because you are going to learn a lot on what this condition is all about and how to prevent it, and as well the treatment. Okay, now what is hepatitis infection? Hepatitis is an inflammation of liver that is often caused by viral infection. Yes, it can also be caused by other factors like toxin or some other chronic medical conditions. Yes, so you should know that hepatitis is strictly the disease of liver. Okay, now let's go to types of hepatitis. Hepatitis A is mostly spread through contaminated food and drinking contaminated water, and contamination with feces as well. Yes, okay. And the good thing about this kind of condition is that it does not lead to chronic infection of the liver. Yes. Okay, now hepatitis B. This is transmitted through bodily fluid, okay, and it can cause acute or chronic infection. This hepatitis B is one of the major deadly part of these types of hepatitis that should be taken cognizant of, and that is why we urge many people to do more of prevention than to contact these particular types of hepatitis. Yes, we have the third one called hepatitis C. It is also spread through blood to blood contacts, okay, and can often lead to chronic infection. Yes, the fourth type of hepatitis is hepatitis D, and it occur only in conjugation with hepatitis B virus. Yes, if you have hepatitis B already, then there is tendency or you having a high chance of having hepatitis D in a chronic condition. The last one here is hepatitis A, and it is usually spread through contamination with food and water, just like in hepatitis A. Okay, now what are the causes and risk factor to these types of hepatitis? Number one is alcohol abuse. Okay, before I go to number one, we have the main one, which is viral infection. Yes, virus is the major cause to this condition. This virus can cause hepatitis A virus, can be hepatitis B virus, it can be hepatitis C virus, D virus, and virus. It is the major cause to this particular condition. Okay, now number two is alcohol abuse. We all know that most alcohol metabolism occurred in the liver, and when it is too much for the liver to to detoxify, it can during the process inflame the liver cells, which are the hepatocytes. Okay, now the number three is toxic substances. Okay, like medications and some chemicals. That is, the ingestion of these toxic substances can lead to you developing this kind of condition. Yes, we also have some medical conditions like autoimmune disorders or metabolic disorders of the liver that can lead to inflammation of the liver cells. Okay, we also have poor hygiene and sanitation, and that is where hepatitis A and hepatitis E can come from, because if what you drink is not hygienic, there is high tendency of you contacting hepatitis A or hepatitis E, because it is gotten through contaminated food, contaminated drinks, and physics. Yes, we have number six, which is unprotected sex. Yes, this is mostly the type that cause hepatitis B virus, and it is very, very dangerous. Yes, the most dangerous set of all these types is hepatitis B, and you ensuring protected sex can prevent you from developing this condition. We also have one cause like sharing of needles and syringe, and through blood transfusion when there is inaccuracy in what's laboratory check during blood transfusion, it can lead uh, uh, to mode of transmission to this particular disease. What are the signs and symptoms of hepatitis infection? Number one, you'll be feeling fatigue, you'll be feeling noisy and vomiting as just the peripheral symptoms. You can also feel abdominal pains because the liver is located within the abdominal region, just at the upper part of the abdominal region, just below the diaphragm. That is where the liver is located. If you are having dark urine, is a sign that yes, your kidney, your liver is having an impairment. If you are having pale and clear colors too, yes, it is also an indication that your liver is having a problem or abnormality. There will be also conditions, symptoms like loss of appetite or yellowing of the skin or eye or jaundice. Yes, anything, any condition that make you to have yellowing of the skin or yellowing of the eye, it is close to disease of the liver. Yes, or any organ surrounding the liver. If you have disease of the liver or any organ surrounding the liver, the number one indication is what? Yellowing of the skin or jaundice of the eye. Okay? Yes. How can we diagnose this particular condition? Okay? It can be diagnosed by doing blood tests like liver function tests and viral antibody test. Okay? Liver biopsy can also be taken to determine what the condition is all about. There is imaging tests like ultrasound and CT scan of the liver can also be used to detect abnormalities in the liver. And also physical examination, which may include what? Palpation and other things to know if the liver is enlarging, that is hepatomegaly, or it is reducing in size. Yes. Okay, now, what are the treatment and prevention of this condition? Number one is vaccination. Yes, and that is why we advise people, if you are not reactive to any of these virus, the best thing is to vaccinate. Okay, so that you will immune yourself against contracting this particular disease. Number two is the use of antiviral medications, and also in severe cases when the liver got so much damage, liver transplant can be what's done. Yes, we also encourage people to practice good hygiene and sanitation and avoid risky behaviors like unprotected sexual intercourse and sharing of needles. Okay? Yes, that is ways you can what? Prevent contacting hepatitis infection. Okay? Now, what are the complications to this condition? The complication to this condition is it could lead to chronic liver disease, and also liver cirrhosis can come into play. Yes, it can develop to what we called, or I call liver cancer. Yes, if not properly managed. And or as well, it can lead to liver failures and extend to other multiple organs damage, which can affect the kidney and the rest of them. At this juncture, we have come to the end of this particular lecture. If you have not followed me on my YouTube channel, make sure you go and follow so that you will enjoy anytime I post an amazing videos like this. Thank you for watching.